Is a colposcopy different from a LEEP procedure for cervical cancer screening? Imagine catching a small problem early before it becomes a serious health concern. That's exactly what happens with cervical cancer screening. When doctors find abnormal cells on the cervix, they often use two different procedures, colposcopy and LEEP. But these procedures serve different purposes and are performed at different stages in the process. A colposcopy is a diagnostic tool. It's like putting on special glasses to get a close-up view of the cervix, vagina, and vulva. After an abnormal pap smear or HPV test, your doctor might recommend a colposcopy. During this exam, they use a device called a colposcope, which is like a magnifying glass with a light, to carefully examine the tissues. If they see areas that look unusual, they can take small tissue samples called biopsies. These biopsies are sent to a lab to check for precancerous or cancerous cells. The goal here is to identify if there are abnormal cells and understand their nature. It's a minimally invasive procedure, usually with little discomfort and quick recovery. Think of it as a detailed inspection to decide what's next. Now, if the biopsy shows that there are precancerous cells or abnormal tissue that might develop into cancer, the next step could be a LEEP procedure. LEEP stands for Loop Electrosurgical Excision Procedure. It's a treatment, not just a diagnostic test. During a LEEP, a thin wire loop heated by electric current is used to cut out the abnormal tissue from the cervix. This procedure removes a larger area of tissue than a biopsy and aims to eliminate the abnormal cells to prevent them from turning into cancer. It's more invasive than a colposcopy and usually requires local anesthesia. After a LEEP, you might need some time to recover and follow specific post-procedure care instructions. The main differences are clear. A colposcopy is used to look closely and diagnose whether abnormal cells are present. It's a visual exam with the possibility of taking small tissue samples. A LEEP is performed after confirming abnormal or precancerous cells, and it's a way to remove those cells and prevent cancer from developing. While colposcopy helps guide the decision, LEEP acts as a treatment to directly address the problem. Both procedures are vital parts of cervical cancer screening and early detection. They work together to catch issues early and prevent serious health problems later on. If you ever need either procedure, remember that your healthcare team is there to guide you through each step, and it's always best to discuss any questions or concerns with your doctor. Always seek personalized advice from healthcare professionals to ensure the best care for your individual situation.